Good morning, everyone. It's my pleasure to kick off this session on priorities for a healthy Asia-Pacific. Today's session is very special because it actually highlights Capri's research as a member of the Partnership for Health System Sustainability and Resilience, or PHSSR. Before we get into the conversation with Vita and Jarret, I'd like to introduce a little about the PHSSR and our last year of leading research for the partnership. PHSSR is a nonprofit global collaboration between academic, non-governmental, life sciences, healthcare, and business organizations with a unified goal to improve global health by building a more sustainable and resilient health system for the future. PHSSR works to achieve that goal through independent, policy-oriented research. PHSSR members include the London School of Economics, the WHO Foundation, the World Economic Forum, AstraZeneca, KPMG, Philips, and Capri, plus additional organizations at the regional and national levels. PHSSR is active in over 30 countries and has published over 26 reports to date on the sustainability and resilience of health systems worldwide. Capri is the Asia-Pacific hub of PHSSR, leading research over the last year on the health systems of the Republic of Korea, Malaysia, Taiwan, and the Pacific Island countries of Tonga, Vanuatu, and the Republic of the Marshall Islands. This time last year, our lead researchers participated in Capri's inaugural annual forum, where they discussed the economic benefits of investing in health, as well as the connections between climate change and health security. Today, two newly published reports on Taiwan and the Pacific Islands are available on the PHSSR's website, and you can also find them through the Capri website today as well, with reports on South Korea and Malaysia forthcoming. At Capri, we've synthesized the findings across all the Asia-Pacific countries studied in the partnership, and this summary report is available in the back, as well as on Capri's website for you to read. Looking across the Asia-Pacific, we found common challenges of aging societies, digital transformation, healthcare workforce shortages, and climate change that are posing challenges to the health systems of the Asia-Pacific. The summary report and the PHSSR country reports provide evidence-based policy recommendations and serve as a springboard for engaging local partners. And we're lucky this morning to have two of our local PHSSR partners joining me in this morning's conversation. First, Jarret Su is co-head of healthcare and life sciences at KPMG in Taiwan, both an attorney and a practicing medical doctor. Jarret has experience in healthcare, biotechnology, and pharmaceuticals, working with biomedical institutions and companies to participate in capital markets. And next to him is Vita Chien, general manager of AstraZeneca in Taiwan. She has been at AstraZeneca for 15 years and has been based across Taiwan, Singapore, and most recently the UK. She has worked in areas across primary care, oncology, rare diseases, and vaccines, and she also has a biomedical science background. So my first question for both of you is, what is the value of a global partnership like PHSSR for both the Asia-Pacific region and Taiwan? Perhaps I'll go to Jarret first.
Good morning, everyone. I'm Jarret Su from KPMG in Taiwan. KPMG is a global organization providing audit, tax advisory, and legal services. And we are a major member of the PHSSR. In order to create a sustainable and resilient healthcare system, cross-border and cross-sector collaboration, such as the PHSSR, are essential to achieve this goal. Take the climate change, for example. The temperature of Taiwan has increased 1.6 degrees in the past century. For CO2 emission, medical institution accounts for 4.6% of total emission in Taiwan. With increasing raining storm, it also triggered the dengue fever surge in recent years. So this is the evidence which climate change will impact public health system in Taiwan or even in the Asia Pacific. Therefore, environmental and sustainable healthcare is not pertinent to Taiwan. Really, it is a global issue. To engage with international stakeholders, such as the WHO or PHSSR, is important to effectively manage the challenge of climate change or infectious disease control, so we can go green and go health together. I would like to tell a story. During the pandemic, as I was a medical doctor, I used to stay in the school gym to take 100 shots of vac in the morning. At that time, the procurement of the vaccination is still a difficult problem in Taiwan. One day, when I saw the vaccine bottle labeled with AstraZeneca, Osaka, Japan, this vaccine from Japan has really touched my heart. I think this is the best model for show the value of the cross-border and cross-sector collaboration for how Asia-Pacific overcame the public health crisis together and to build a sustainable and resilient healthcare system. Thank you very much. Thank you, AstraZeneca.
Thank you. So my name is Vita Chien. I am in AZ, like Caroline said, I'm in AZ for 15 years. Throughout these 15 years, I've been to Singapore, to UK, and then come back to Taiwan. I see quite a lot of similarities. For example, aging population, non-communicable disease, because the lifestyle is getting better and better. So it's the same problem, not only because of climate, because of pandemic, but also our aging population that is actually generating now and future more on how do we take care of the people ourselves even in the past 10, 20, 30 years that we are going to live healthy. So as a pharma company, we continue to innovate. So in AZ, we have 5 innovation areas on cardiovascular, metabolism, and diabetes, oncology, cancer, where we try to cure it. So it's not just the very scary disease anymore. It is something that we want to change it to chronic disease, which is also a very long-term care. And then we have rare disease. We have respiratory, so asthma, COPD, which is actually really related to the air pollution and also the climate. So all 5 areas, and of course vaccine. So all 5 areas is the one that we continue to innovate, not just the medicine itself, but also the patient as an end-to-end solution from education to all the aftercare. So I'm very glad to partner through PHSSR and also with KPMG, where we can, first, we have the same goal. Health is very important. Health life is very important. I was really looking into the AI technology and how this can help on the health. But then I think one thing in common, Asia Pacific and also across the world, is we are facing the same thing. We're facing that we need to provide a long-term sustainable health for us, for the population around the world.
Thank you both. And now I'd like to turn to some of the findings of the Taiwan report, which actually features a bilingual preface by Capri's board member, Professor Zhan Changquan, who's here in the second row. For Vita, I'd like to ask about basically the fact that many of the findings in our Taiwan report is connected to the fact that Taiwan is poised to become a super-aged society by essentially next year. As the population ages, people's healthcare needs also evolve, especially as chronic disease and chronic conditions become more prevalent as people get older. So what does this demographic shift mean for the financial sustainability of Taiwan's healthcare system, and what can be done to ensure that the system is ready to care for a growing aging population?
Yep. Thank you for the question. So, like you said, Taiwan is going to face to super aging, not just aging, super aging from next year. So one thing good about Taiwan and being aboard and coming back, I'm still very proud of Taiwan having a reimbursement system. Now, this year is 29 years. So the government has been taking care of the patients in a very long time. One thing that I've mentioned previously is that now we are facing the super aging population, more and more people that are bound to have chronic disease on the diabetes, hypertension, dyslipidemia, and so on. And also with the new technology and new innovations, cancer is unlikely to die like soon. So it's a very long-term care that we're facing right now. So we need to see how we can sustain with the healthcare and to the populations that they are eligible for the good treatments. So that is sort of our obligation to do it. So one thing is what we see is the overall healthcare service. So the nurses, which is not just a Taiwan problem, it's everyone's problem. Nurses, the infrastructures, so the long-term care, aging population, the retirement homes, those are the ones that we really need to innovate and see how we can sustain and fund it. The second one is the innovation to treatment. So the treatment is actually started from early screening to the new innovations, so new drugs, and then to any aftercares like the patients, how do you come back to the clinic and how do you really sustain the good treatments and then how you manage the side effects. So those are the treatment-wise that we really need to help the patient to get the right and the new medicine for them to have a good quality of life, to live longer and contribute to the society longer. And the third one is the technology. So we all talk about AI, we all talk about technology. How do we bring technology to the healthcare to make everything more efficient? So those are the three things I want to emphasize on the sustainable healthcare. But mostly, I want to highlight it on the financial bit. It is very costly, to be honest. Yeah, to take care of people is very costly. And to take care of the people with the right medicine and right treatment is costly. But how do we actually work with the government on the social fundings and also private government's fundings to make sure that this is not just government's problem. This is our problem as well. We need to help together as a team to see how do we contribute to make sure that our population is getting the right treatments that everyone can get it. Not just the rich people, everyone can get it. But this is something that we need to innovate and to see how do we blend in the private insurance, government insurance, or social welfare, anything else. So that is something we should do.
Thank you so much, Vita. And aging populations is a common challenge among all the high-income Asia-Pacific societies. We saw that in the Korea report that will be published soon, as well as in the Japan report. And we actually have Nomura Sensei, who authored the Japan report, speaking later, though not about that particular part of his research. Jarret, the Taiwan report highlights this island's global leadership in the information technology industry as an opportunity for integrating digital technologies into the health system. From your perspective as both a doctor and as a lawyer, what are some of these opportunities, and do they also come with their own challenges?
From the perspective of a medical doctor, technology innovation could be observed from three key dimensions as well. First, identifying opportunities. Second, integration of technology. And third, how to face rising challenges. Taiwan semiconductor manufacturing and healthcare services have gained global recognitions. These opportunities give Taiwan a unique leadership position to influence adoption of IT technology and healthcare system. For example, of integration, the smart IC card and the MediCloud system are the well-known application of the national health insurance in Taiwan. The smart IC card contains some crucial health data, including drug allergy history, consent for organ donation, and the order of DNR. By medical system, medical doctor can review patient's drug prescription, lab data, and medical image, such as the MRI or CT, to reduce the drug duplication and to enhance medical resource utilization. Nonetheless, challenges are imminent, especially for human rights and medtech application. During the pandemic, as a doctor, when I insert the IC card, I can check the traveler history or get a risk alert of quarantine. But tracing the location of patient in quarantine by smartphone system or the travel history by the IC card may lead to the concern of personal privacy. In addition, for developing medical AI, industry need large patient data to create or make the best decision making for health system. However, the utilization of MediCloud or other research database without the patient's specific research consent also trigger the unconstitutional debate. Therefore, data privacy protection versus public health and medical development are challenging issues in this case. So, to create a sustainable and resilient healthcare system, Taiwan's experience offers invaluable lessons for how to harmonize the technology innovation with human rights protection. Thank you very much.
Thank you so much, both Jarret and Vita. And I believe we're coming up on the end of our time, so I'll just wrap up with just by saying how much of a pleasure it's been to work with both of you over the last several months through the PHSSR partnership. It's a very unique model in which public, private, and academic sector works together to enhance the sustainability and resilience of health systems all over the world. And the partnership later this month will be going to the World Health Assembly. And so please keep an eye out for those events, as well as check out the research on PHSSR's website, as well as on Capri's website. Thank you so much. And I know you are all wanting coffee.
Thank you very much, Caroline, for moderating this session. A round of applause for our panelists and our moderator.